On behalf of Mrs. Marianne D'Souza, who is the Director of the New Bedford Health Department and the Chair of the GNB Coast, Chana, who cannot be here this year due to a prior family commitment, I'd like to welcome all of you to the 11th Annual Legislative Breakfast and to our timely theme this year, which is Walking the Walk.
I'm Wendy Garflip. I'm the Executive Director of United Neighbors, and I'm also the Chairperson of the Greater Fall River Partners for a Healthier Community. I echo Pauline's words in welcoming you all to this amazing event. Greater Fall River Partners and New Bedford Coast are both working to improve the quality of life in the communities we live in by promoting healthy living, establishing programs and initiatives that educate and motivate our residents. Every one of you sitting in the room today sits here wearing two hats: the hat you wear at your primary job and the hat you wear today as a member or a supporter of Partners or Coast. Now it is my privilege to introduce our partner, our supporter, and our mayor, the Honorable William Flanagan.
By coming together here today, by bringing all the various agencies and partners together, we have an opportunity amongst ourselves to discuss ways we can make our communities healthier places to live. And right here in the city of Fall River, working with the various partners that are in this room, we've been able to lead forth a number of initiatives which is making the city of Fall River a healthier place to live. From instituting a farmer's market, to doing a healthier school lunch program, to doing a staircase art gallery at City Hall, encouraging employees to take the staircases, to doing such activities as bike rides and road races. We're doing our part to make the city of Fall River a healthier place to live and a healthier place to also. And I want to thank everybody for being here this morning. I look forward to seeing the program, and also look forward to discussing with you ways we can improve the healthy well-being of our communities and also to improve the quality of our lives. Thank you, and God bless all of you.
I think that this is beginning an educational process to change choices and lifestyle of America, New Bedford, Fall River, this area, in the 21st century. And quite frankly, trying to get back to what we considered to be some norms when we were growing up. So thank you very much for asking me to just come by and speak. Thank you.
Always a great honor and pleasure to be here to join you for this breakfast, and I just want to simply say congratulations to all the partners that have worked and made so many great strides over the course of the last year in improving the health of our greater South Coast communities. Especially to those award recipients from the local communities that have done their part to make their local communities a healthier place to live in and to work in and to raise a family. And to wish you all the best of luck over the coming year. We'll be with you, myself, my colleague Dave Sullivan, collectively all of us in the legislature are always there and will be there to support you in your endeavors to make our communities a better place to live. Thank you all very much.
To make a few comments. Many of you know I worked in social services, I worked in the mental health field, and this initiative by the partners in Coastal is something that sort of ties into what I saw in my experiences in mental health. Oftentimes in the community years ago when they talked about mental health, everybody sort of focused and said, oh, there was a stigma involved in that. But mental health is about something being healthy. It's about healthy attitudes. It's about taking advantage of terrific attributes we have in our community for wellness operations. I think of the bio-reserve for walking and hiking and biking, and us taking the initiative to eat well and to do well. I just think that we're at the beginning of our journey. I truly do. And I think we're moving forward. And I look at this group here, and I'm very, very impressed that we have such a group that can be together and that can send such a strong message, not just to the community, to our state and to our nation as well. I want to thank you. It's an honor to be here, and I'm looking forward to the program.
I
our keynote speaker for the day, the pièce de résistance. Some say he lives to walk and bike. Some say he's all about health. Some say he's turned some government heads and people of great wealth. Although he's spoken countrywide, from our coast to the west, we're sure he's back in our south coast because he likes us best.
Thank you so much. I really appreciate it. You're very kind, and thank you for the help with this. You'll notice that I have lots of pictures from here because I've had the pleasure of spending time with you before. And indeed, I was just saying how excited I am to be back here because I'm really excited about what's happening. It's going to be pretty challenging. I'm not going to just go easy on you because I don't do you any favors if I do that. So I'm going to challenge you this morning, and I hope if everybody squirms in their seat at least once over the course of the morning, that's a good thing because that means I am challenging you to think differently. I'd like to make 6 simple points this morning, and it's going to seem like I'm sort of out there a little at the beginning, but I kind of have a reputation for being out there at the beginning. So the European vacation paradox is what I'm going to start with. I'm going to talk a little about winning battles and losing wars, perspective on what really ails us, and then I'm just going to give you the bad news, which I'll boil down to basically 3 numbers, the good news and the hard news. And the hard news, I'm going to get pretty specific to this area. I'm going to continue to push on ideas that we began to generate as long as 1.5 years ago when I first visited Fall River and continued the dialogue through New Bedford, and that I know you guys have been working on. So with that, here's the European vacation paradox. It's as simple as this. Does anybody know somebody who's gone on vacation in Paris or Rome or somewhere in Europe and come back and said, I got to tell you, I had a wonderful time. She's waving her arms violently saying, yeah, what a great time I had. Inevitably, by the way, people tell me, it's the Europeans and it's what they eat. Because I got to tell you, I was over there for 1.5 weeks. We did everything, and I ate everything inside. I ate really well. I lost 3 pounds while I was over there. Does anybody actually have that experience or know somebody who said that's happened? Went on vacation in Europe, lost 3 or 4 pounds. Okay. Now, I don't really think it's a paradox because you guys all know what happened. We'll ask them, what did you go see? Then what did you eat? Well, we ate the normal diet that they eat over there. And then they'll say, by the way, what kind of car did you rent while you were there? They say, oh, I didn't rent a car. We walked everywhere. I took the bus, we took trains. We didn't rent a car. We got off the plane, never touched a car, then jumped in a cab once in a while. They moved constantly. And if you think about it, that's often how many of the cities I was lucky enough to be with my family over in Rome last year, and that was our experience. No rental car. The second thing I told you I was going to challenge you with is winning battles and losing the war. And I had the good fortune of visiting Valley Forge National Historic Park. And what's Valley Forge famous for? Somebody here tell me. Does anybody know the story of Valley Forge? Realization. Washington won that although he was losing the battles in the field, the British were trying to maintain this war across an ocean at great expense, not very popular back at home. Does that sound familiar? And he said, I could be losing battles, but still possibly win this war. Whereas the British had not yet realized that despite the fact that they were winning the battles, if the colonials just hung in there long enough, they were going to probably lose the war. Now, where is he going with this? I would suggest, in public health, that is just what we have done so far. Won a lot of little battles. A nice trail here, a great walking program there, good fruits and vegetables in this one school where we've got a very forward-thinking principal and said, I'm willing to change the nutritional offerings in the lunch line here, one at a time. We're winning the battles, but on scale, we're losing the war. We have not shifted ourselves as a society around these 2 big initiatives quite yet. Which is exactly what you're trying to do here. And I give the example, by the way, not just of Valley Forge, where the trail was beautiful inside the park, but you couldn't ride a bike there without taking your life into your hands. Because the roads have no shoulders, no bicycle lanes or anything. So you have to drive a car to the park, then you can ride your bicycle. And in fact, I suspect we're doing that all over the country. Even as we save some acreage here, build a nice little segment of trail there, we're still putting subdivisions out there without sidewalks in them. We are literally doing that. We're building big box malls that are designed only to drive our car to. That's illustrated by the photo on the right there. Another subdivision, and if you look closer, you might even see there's a school with baseball diamonds right here, but there's no pedestrian connection from all these houses that are going to be in the subdivision to that. Those kids either have to walk out onto the road, big busy road, walk down here and back into the school, go 1.5 miles for what should be a 1/4 mile trip, or more likely, ask mom for a ride, right? As long as we keep designing it that way, we're going to keep losing the war. Even if we make a nice little playground inside that subdivision, I submit, we lose the bigger war. You win the little battle. Here's my last point. Let's bring it to a much more recent history. And I think one of the mayors actually sort of brought that, got us thinking this way. Mayor Lang sort of challenged us to think this way. So do a little exercise for me. Those of you who have spent time with me before know this exercise, but bear with me. Join me anyway. Think for a minute back to your earliest fond recollection of being physically active as a youngster. So now we're not 2,000 years ago, we're not even 200 years ago. I'm talking, for some of you, 20 years ago, for some of us, maybe a little longer, but go back to when you were a little kid. I'm not talking about high school sports. As little as you can remember, your earliest fond recollection of being physically active, okay? Then I want you to turn to the person next to you and share that recollection for 20 seconds, 10 seconds each. Earliest fond recollection of being active as a youngster. It's really fun to kind of have that recollection and have that conversation, isn't it? And I heard everything from playing baseball in the street when the work kids weren't coming, playing hopscotch, to just running around the neighborhood, to chasing little girls at recess. How many of you would recall to some degree having been a free-range kid? Hands up if you were to some degree a free-range kid. All right, here are my last two questions. How many of you believe, now really pay attention here, that the majority of children today, over 50% of kids today, are free-range kids? If you were really to honestly assess it. Okay, and how many of you believe it's good for their health and well-being, and in particular for their long-term chronic disease risk, that they are not free-range? It's a good thing we don't have free-range kids anymore. Okay, so let's think about this for a minute. What we've said, just to use you as a survey sample, and you replicate everybody else I talk to around the country on this, to be clear. Just a generation ago, a lot of us were free-range kids. We believe now the majority of kids are not, and it's probably not good for them. So my simple question, if I boil all of what I'm talking about down to this, what are we going to do about it? Wring our hands and say, well, it's a different world. We have a lot more single-parent households, a lot of households where both parents work, but the roads are much more dangerous. It's a scary place out there. We're going to just give up on it? Or are we going to do something about it? And I know the answer. What I think is the most important research in the field in the last 20 years, perhaps, called the Diabetes Prevention Program. And the Diabetes Prevention Program, DPP as they call it, does a very simple thing. It takes 3,000 people from all over the United States of different ages, incomes, ethnic backgrounds, geographic areas, with one thing in common. They have an elevated fasting glucose level, but they don't yet have diabetes. So they're at risk for, but have not yet developed diabetes. Now, here's the interesting thing. They put them in 3 groups. One group gets the standard counseling. Here's a pamphlet and some information and put on a prescription. Second group, same pamphlet, same counseling, and they get a prescription. And what they don't know, half of them are getting metformin, a diabetes drug, and half are getting a placebo. The pill doesn't do anything. It's called a randomized controlled trial. It's the best kind of research we can do, and it essentially tests the effectiveness of the drug, right? Even the researchers don't know who's getting what. Interestingly, and to the great credit of the researchers, there's a third group in the study, and they don't get a pill, nor do they get the standard counseling. What they get is put in an intensive lifestyle modification program that includes things like shopping and cooking classes, so they learn how to purchase and prepare healthier foods, and at least 30 minutes of physical activity 5 days a week. So about half an hour a day, at least 5 days a week, moderate activity, things like walking. Now, who has not heard me speak before knows which of the groups did best? Hands up if you know. Which group did best?
30 minutes a day exercise.
Do you know that for sure? Did they do a little bit better?
They did a lot better.
They did a lot better. In fact, the people who got the drugs saw almost a 30% reduction in risk of developing type 2 diabetes compared to the people who got the placebo. That's a big deal, because my problem is this. We got to stop talking just about an obesity epidemic and talk about the 2 things they intervened in the study and the 2 things that are driving the issue around the country, which are epidemics of physical inactivity and poor nutrition. And that's my rant, and I'm sticking with it. Change the conversation. You're doing it, however, not really for that guy. And I'm not doing it for any of you either. I've gotten to love some of you personally. I've gotten to know you. I consider you a friend. But I really don't care. I don't. You're big boys and girls. You're going to make your own decisions. Who am I, a raving, froth-at-the-mouth lunatic? Those of you who've heard me before know I tell every audience this. Who am I really doing it for? And who should you all be doing it for? We're raising a generation. Continue to hear about the great work you're doing. Share with it around the rest of the Commonwealth, around the rest of the country. Thank you so much for having me. It's a pleasure.